Hello, my name is Jennifer Reynolds. I am a registered nurse in outpatient eye surgery at Providence St. Vincent Medical Center in Portland, and I'm very happy to be sharing with you some of the work that I've been able to accomplish in our home care for patients using health literacy best practices. So first, a quick review on how health literacy is beneficial to people as they go through their healthcare journey. Navigating the healthcare system at all can sometimes be extremely confusing. Making appointments in the first place, let alone following up with referrals, specialists, it can get pretty confusing. Filling out forms and sharing health history, and increasingly there's digital means of making appointments and seeing providers, providing your information before a visit. But if your digital forms are also difficult to navigate, that can be a problem. Chronic illnesses and disease management. If you have a diagnosis of diabetes or COPD, these can be pretty daunting situations and may require lifestyle changes. Potentially complicated medication regimens. I got to take this medication for the rest of my life. What am I going to do with that? Mathematical concepts like probability and risk. What is the risk of getting worse? What are my chances of getting better? Making informed health decisions about how they were going to take care of their health in a global fashion all depends on how we deliver it. And it doesn't help that many times healthcare scenarios involve high-stress situations. We may be making these decisions in the emergency department. Again, a long-term change in lifestyle, diabetes, COPD, kidney failure, these are big things. Technical or medical jargon, we tend to just kind of let these words roll off our tongue because we're used to using them, but they really aren't helpful for patients in the long run. And then large volumes of information at once. We love to give a bunch of information right before the patient leaves or something like that. And remember that this all includes numeracy too. What does a glucose level of 300 mean? What do those cholesterol numbers mean anyway? How is this going to affect my overall health? Health literacy is a stronger predictor of health outcomes than income, employment status, education, or ethnicity. Let that sink in a minute. That's a pretty powerful statement. So this is what we do, right? We flood people with information when more doesn't necessarily mean better. And while we often speak in layman's terms, we also pepper our information with jargon or terminology in with what we're saying or with what we're writing. And that's why plain language is so important. Plain language is communication that users can understand the first time they read or hear it. With reasonable time and effort, a plain language document is one in which people can find what they need, understand what they find, and act appropriately on that understanding. So organizing the information so that the very first important things are at the top of the list. Chunk and check. So we're going to group that information into little bits and then check in with the patient to allow clarification or questions. Getting rid of the jargon. Sometimes though, we have to use it. But if you do, just explain it. Apply the information directly to the patient. Use your heart versus the heart. Speak plainly, write plainly. And we as caregivers put the responsibility on ourselves to make sure that we have communicated clearly. So you could say something like, I want to make sure that I've communicated clearly. So when you get home, how will you tell your wife how to take this medication? When people ask how cataract surgery is done, I don't say, well, we enter through the anterior chamber and remove the opacified nucleus. I say, if you picture your lens as an M&M, excuse me, and we're going to take the top candy shell off, we're going to scoop out all the chocolate and leave the back candy shell. It's still kind of abstract, but most people can picture an M&M and get the concept. Familiar words. You'll see later in this presentation that we don't use excrement or stool. We use the word poop because just about everyone knows what poop is. So we're going to use those familiar words, Avoid abbreviations and acronyms. Those letters don't mean anything to a lot of people. And when I see acronyms in information I'm looking at, I'm like, am I just the only one who doesn't know what that means? Keep it short and simple. Writing goal is no higher than an 8th grade reading level, and there are things out there to help you with this. The Health Literacy Advisor is software, and you enter your document into that, and it gives you information on reading level, grade level, ease, all kinds of different information. SMOG and Flesch Reading Ease are available online for free. Same concept, you enter your information in there and it gives you information back on how difficult that document is to read. Keep sentences short, 10 to 15 words is ideal, and paragraphs limited to 2 or 3 sentences. And again, avoiding medical jargon and abbreviations, that's okay. We just need to explain what it is and then go on. Most likely, patients are going to hear these terms over and over during potential office visits or treatments. Make the document scannable. Use subheads in bold or underlined text to break up the information. Blue and black font colors. Think about how the document will look if it's printed in black and white. Light-colored fonts will print gray. There's a big discussion on whether or not to use serif or sans serif typefaces, and when you look up the definition of sans serif, the definition is a type of type without serifs. Thanks for that clarification. Serif types have a slight projection finishing off a letter. My bullet pointed lists are in serif. An example of sans serifs are my headers. No little things flinging off the ends of the letters. Health.gov suggests sans serif is a preferred typeface because people are used to seeing it on websites. But CMS.gov suggests sans serif typefaces for headings and serif for regular text. Overall, it seems statistically insignificant when you take a look at this in depth. Font size and color seem to be more important in the long run. So we're going to use the 12-point font size and limit the use of different font types. No italics. In some fonts, the italics can get pretty funky looking when they're printed out, and we don't want letters blending into one another or being difficult to read. Don't use light-colored print on a light-colored background. Want to stick with dark blue or black font colors. Use bullets for lists, and limit to 7 or less if you can. Use graphics, but position them next to what they are illustrating to make it easy to understand. And then white space is really important. If we cram a bunch of information onto a sheet, things are going to get lost no matter how you group it. So we need to really kind of thin that out and allow for that white space. Action, action, action. Basically, people really just want to know what they need to do when they get home. So we're going to put that call to action first when we write things. Begin directives with action words. Do this. Don't do that. Call your surgeon if. We want to address the reader again using your heart versus the heart. And it's okay to break grammar and style rules to make the tone more conversational. So it's okay to begin a sentence with and or but. And we want to use numbers, the actual numeral, instead of writing numbers out. There are several websites that allow for free use of their collection of icons, and these are 4 that I have used. I just did a search of medical on each site and selected one at random, but I've been able to put something in like medication and all kinds of vials and pills, and different types of medication icons come up. And then you just have to select your style and how it fits directly with your message you're trying to convey. Putting the icons or graphic next to the message is essential so that that message is clear. And when you're choosing your icons, choose something that is that flows. So if you like the icons8.com image there with the beaker and the syringe, it's outlined. Do you want to use all outlines on your document? The dark colored image, the nounproject.com. If there's maybe if the paper is sparse, not a ton of information, maybe that dark contrast with the text is going to look best. But choose something that's kind of uniform. Using color, of course, that's always great, but again, you want to make sure that you are actually printing these things in color so that they don't fade to gray. At times I've been the subject matter expert, and at times I've known just enough about the topic to be dangerous. So what is the end goal for the document? Who's your intended audiences? Most drafts are going to need multiple attempts. So clarify that content with your subject matter experts, and so that you really have a clear vision of what you're creating in the first place. Having your experts look back at your documents after that first draft, you can reword things, you can move stuff here or there, so that you really start to whittle down what your intention of this document is. It's always a work in progress. Even if you are the end user, it's probably a really great idea to have someone else take a peek at your end product, because it just gives information for you. Sometimes people see things that we don't. We know what we're thinking, and so this other person who is not in my head, doesn't know, oh, that's what that means, can say, well, what does this mean? So it can really be helpful to have somebody else take a look at your document. And be receptive to changes in words and content. Again, if you are not the subject matter expert, this is not your document. We are the health literacy experts here, but we're trying to create a document that conveys the message that our basically, client or end user is going to use. This may be a new document overall, or it may replace a document that already exists. So if this is a new form for people, or even replacement, if there's education that needs to happen before the use of this form actually gets in use, allow that, because there's no sense in going through all of this great process and having a great document when people aren't using it correctly. So when we started using Epic, I wrote a smart text that covered home care for each of the different types of surgeries we did: cataract, retina, cornea, muscle surgeries, and I thought I did such a good job of using plain language with these written instructions. I had all kinds of information on here, but I still thought I kept it relatively short. And on investigation, this document is written at an 11th grade reading level, and I still had a lot of nice to know information rather than just really focusing on the need to know. And this is also inserted onto the last page of an after visit summary. That's where this additional discharge information gets put. And for anyone who uses Epic, you know that these AVSs can be extremely lengthy, text heavy, and being on the last page, this information got buried. And I don't know how many people you actually look at your AVS. I don't. So it really was, we were sending home information that was never going to be seen. So this was originally on our home care sheet, the one I just showed you. If your eye is causing you discomfort, you are encouraged to take your prescription pain medications, Tylenol or ibuprofen. Sure, that'll work. But we could probably use a better word than encouraged. So we give this another go. If your eye is causing you discomfort, take pain prescription medications, Tylenol or ibuprofen. That's better, but I bet you we could still improve on that. Take pain medications as needed for discomfort. It's really all you need to say. So when I revised our instructions to use the icons, I was very careful about the language to include, and the document is now written at a 5th grade reading level. The information is grouped, it's easily found. White space allows the user to find what they need quickly and easily. This information is very easily reviewed by a family member or a caretaker who wasn't at the hospital with the patient. And for retina surgery recovery, Patients are sometimes required to position their head a certain way due to a gas bubble being placed in the eye. And we can include spaces to write information that personalizes this home care for each of the patients. And this is one sheet handed to the patient separately from the AVS. Retitling the document differently from vitrectomy to retina surgery also makes it more friendly. So we hand out that AVS. It has information about the procedure that they had, their providers. But this home care instruction sheet is really what they need to know for home care. So now that you have your format, you can also have your forms translated into other languages. And on our unit, the top 5 languages we hear other than English are Spanish, Korean, Russian, Vietnamese, and Chinese. And bonus, Mandarin and Cantonese are the same written, so we got a 2 for there. They're different when they're spoken, but they write out the same way. It said a picture is worth 1,000 words, and so here we're using pictures. And as I mentioned, head positioning may be necessary after retina surgery because of that gas bubble placed in the eye. And before surgery, nursing staff are all acting out all these kind of different ways on how they might hold their head. We're trying to explain how to accomplish this recovery positioning and going through all kinds of, charades type of thing. So enter my husband, Bob, and his willingness to humor me for this sheet that we made. So we can show patients exactly what we mean, and they have this sheet to remind them or to show to family members who are helping them out at home. And you'll notice the blue was used for headers, but this form is printed in color, so it looks just like this when the patient gets it. And then I also developed these picture sheets that get sent home with patients to help them with their eye medications after surgery. And as you can see, one medication may be 3 times a day, another is 4 times a day. Some drops are 1 time a day. Personally, maybe I made these for me, but I would have a lot of difficulty remembering what I'd taken or how many times I'd done it. And these provide a simple check off so that they can track their dosing. The date is written in the first column, and then they can check off their administrations as they go throughout the day. And we say to time these with breakfast, lunch, dinner, morning, noon, afternoon, evening, or morning, noon, bedtime. Something that also kind of ties it into something that they do all the time anyway. And just kind of reminds them, oh, yep, it's bedtime. I need to get that drop in. So now once we have this clear format, we can successfully implement it in other procedural areas. So in the medical procedures unit, physicians weren't sending home any information regarding same-day home care. Patients got pictures of their beautifully cleaned out digestive tract, but really no information about potential complications, what to do, what to not do once they left the hospital. And for some procedures, dietary intake should be specific. So there's a place to fill that in for the ultrasound procedure if needed. Post-podopectomy bleeds are a potential risk, and they can be severe. So the patient needs to know when they should be concerned and contact their doctor. One colorectal surgeon requested this specific statement regarding potential post-procedure bleeding. You feel like you have to poop, but it's all blood or blood clots. And you may have seen information somewhere that says something like, if you see 2 tablespoons of blood in the toilet, if you see a 1/4 cup of blood in the toilet, I wouldn't know what that looks like, and it's very difficult to quantify an amount in the toilet bowl. This is pretty clear. I worked with a couple of inpatient pediatric nurses on topics that they see on their floor all the time. The appendectomy home care is not in use because the surgeon group couldn't agree on when to return to PE class for the patients. Though a line could have been used there to fill in the 2 or the 3 weeks that they were debating on when they wanted their patient to return to PE class. And it kind of fell off the radar, it wasn't pursued. But a pediatric hospitalist picked up the torch and gave input for the bronchiolitis home care. and that is in use. And for pediatrics, airway is it's such a big deal. Things can go south very quickly. So I need to know when I need to call the doctor, but I also need to know when I need to call 911. And then our surgical prep unit came to me to talk about a urology home care sheet. And you can see we followed our basic format, adding headers to the specific content that patients need to know. And they started with basic information, and then they had their urology docs give input. They brought it back to me. We messed around with it some more. We sent it back to the docs, and through back and forth, we finally came to this document. Having a stent is like labor pain, and that's under the normal header. I guess that sets the tone for recovery. But this is not only important for patients to know, this is where you get your provider buy-in. It's really important to consult your providers when you're working on these forms so that they can say, oh, well, that's a great statement, but let's change it to this. How many after-hours phone calls does having this statement on a home care sheet eliminate? If it's going to save them time answering the phone when someone says, boy, I'm having this really severe pain, feels like I'm in labor, that's under the normal section. So it may slow down somebody from contacting your doctors after hours. And here's a time when that provider does want the patient to call. They see chunky tomato soup when they pee. This, again, was a surgeon request. And chunky tomato soup is going to look a whole lot different than the cranberry colored pee that is under the normal section. This form was brought to my attention after we reworked the diagnostic imaging group of home care. And it was developed in mammography at a sister hospital. And in 2020, the diagnostic imaging staff, nursing staff, and I worked on 21 of their home care sheets. And then last year, I think we did another 11. And these went through the process of back and forth and back and forth. They were approved by a regional managerial committee for diagnostic imaging. And so those forms are used regionally. They follow the same format. But this one created outside of that effort, and it's almost there, but we have a good look at it, and the font is 10 point. So there's a lot of information squished onto there because it's all important, right? It's got a bulleted list, but those things are not broken up into smaller sections so that it's easier for me to really find what I'm looking for. And that blue color that the headers are in, love it. But this is a photocopied form, and those headers go to a very difficult to read gray when they're in black and white. There's the use of the words agents for medications, pathology for test result. So this was a very difficult task because the people who developed this form were very proud of it, and they had spent considerable time and effort working on this form. And it was difficult to bring up with them how this was a really great form, but we could probably make it even better if we kind of changed things around. And it certainly could have been used, but when we're striving for uniformity and the best information that we can provide patients, it wasn't quite there. So there were a few phone meetings. Several drafts later, we got to a form that everyone was happy with. And we ended up actually doing a couple of forms for the west side of the river, a couple of forms for the east side of the river, because they didn't do their prep the same, and that's okay. The nice thing about having these forms in-house is that we can revise them at any time. We can add, remove, information, change phone numbers, and it's super simple. And again, this form, we've got some basic information at the top, bulleted lists. We've got some icons that bring the reader to specific chunks of information, and then contact stuff at the bottom. Making sure we give information to patients in a way that is easily read so that they may actually read it is super important. And the use of plain language is important so that patients will understand what they're reading. Being able to take that information and use it in a way that is beneficial to their health is huge. References for the documents used in this presentation. And this is me. I am more than happy to answer questions about this presentation or document layout that you might have, different icons that might be used. I hope you found this presentation helpful and will go out there and create some fantastic documents.